Bernick, a neurologist at the Cleveland Clinic Ruvo Center for Brain Health, has treated hundreds of individuals who are living with dementia. And today he shares the latest research on Alzheimer's.
It's an exciting time in our field. I've been involved in the Alzheimer's field for over 30 years, and I would say that this is really, within the last 5 years, maybe a little longer, but this has seen the most changes. So we can diagnose the disease very accurately up to 10 years before you even have symptoms. We can identify the disease process. And that's led us to the ability to treat the disease early. The tests we use to diagnose Alzheimer's disease all in some sense identify a protein in the brain called amyloid, which we know starts to build up 10 years before you have symptoms. It builds up in the brain as plaques. And we can identify plaques several different ways, most recently with a blood test that can measure the amyloid protein. But we don't feel that that's, at this point, accurate enough to be certain about the disease. So it's a good screening test. And then we have more advanced testing so we can measure the amyloid protein in the spinal fluid. And now we even have a scan of the brain that can image the plaques. It's called PET amyloid imaging. And those two tests are extremely accurate in identifying the disease. So all these tests that I speak of are really for people who are beginning to have symptoms of the disease process. The earlier we can institute treatment with these new therapies, the better the response. Now, that's not to say that people earlier in their life can't do things to delay or prevent Alzheimer's disease. One is exercise, and the recommendation's now 150 minutes a week, so 30 minutes, 5 days a week of something that does get your heart rate up. Some we call it a moderate intensity exercise. Diets that are rich in antioxidant foods or anti-inflammatory diets. A common one that we use as an example is a Mediterranean diet. Of course, staying mentally engaged, keeping yourself active, keeping your mind active. And it also seems like sleep's important too. That is, during sleep, we can rid our brain of toxic substances that build up. And so it is important to try to maintain as best as your sleep as you can. And then finally, it's managing any other medical illnesses, particularly those that affect the vascular system, high blood pressure, diabetes, high cholesterol, not smoking. All these things, if they're treated aggressively, even in the middle of your life, may help protect you from Alzheimer's disease or other forms of dementia as you get older.